Member for Prince Edward Hastings.
Thank you so much, Mr. Speaker. I'd ask that you send a page with a good backup. This one is 5,520 signatures on it, and it comes from the county of Prince Edward. To the Legislative Assembly of Ontario. Whereas the grievance of citizens of Prince Edward County is that our hospital is being moved toward extinction, and here, following our history, we outline our request. Whereas prior to the forced amalgamation in 1998 of the formerly named Prince Edward County Memorial Hospital, Picton, Ontario, the records show that the hospital was a financially responsible, full-service 42-bed facility funded and built by county residents, service groups, and practitioners. Whereas Prince Edward County Memorial Hospital had for many years been developing an integrated primary health care network based on the partnership model with the consumer as its focus, firstly on palliative and long-term care. Whereas the Prince Edward County Memorial Hospital Board of Governors offered to adopt a partnership model at the regional level, a continuance of voluntary cooperation without increased administrative costs and a larger, more expansive bureaucracy, which was deemed to result if the county hospital was forced to amalgamate with Quinte Healthcare Corporation. Whereas since the 1998 forced amalgamation of the Prince Edward County Memorial Hospital with Belleville General Hospital, Trenton Memorial Hospital, and Bancroft Community Hospital into an organization named Quinte Healthcare, there has been a steady and severe erosion of Prince Edward County Hospital medical services, equipment, and number of funded beds and community-raised funds. Whereas we have moved from well-equipped community hospital with emergency services able to provide a range of medical services, including obstetrics, backed by an impressive contingent of superior medical staff, technicians, nurses, and management. We serve an important rural, urban, and huge tourist population. Whereas very important also is the historic referral pattern from Prince Edward County Memorial Hospital to the Academic Health Science Centre in Kingston. Established partnerships with the Kingston Healthcare Services were made long ago, whereas now, 15 years later, we're living with the realities of the programs outlined above. To the detriment of health and well-being of our citizens, this diminishing process has reduced our thriving hospital to a minimal clinic centre. This raises the spectre of probable elimination altogether. Thus, one of our most important centres of voluntary activity and economic benefit would also be lost to the county. We, the undersigned, petition the Legislative Assembly of Ontario as follows. For the safety and best interest of the citizens of Prince Edward County, we ask for an early meeting with the Minister of Health and Long-Term Care, Deb Matthews, her deputies as appropriate, MLA Todd Smith, and the medical elected and lay members of the County of Prince Edward. Our request for a meeting with the minister is to highlight the major changes in the past 15 years and to address the re-establishment of the county hospital as a not-for-profit corporation under the governance of an elected board. I'm pleased to present this to the table this afternoon. Thank you, Mr. Speaker.
Thank you for the petition.